Good evening and welcome to the Greater Rutland County Supervisory Union November 17th meeting. If you would please join me for the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
It's like we're doing it in
I know.
rounds.
Like a stadium.
Yeah, right. All right, the first order of business would be the approval of the agenda, additions, deletions, changes. I have two changes under policy. If you would remove C, which is F6, transportation, and J, which is F12, weapons and firearms. Those two policies are going to stay with the policy committee. So are there any other changes, deletions, or additions to the policy?
I make the motion amended.
Motion by Mike, second. Second by Eric. All those in favor?
Aye.
Any opposed? Motion passes. General public comment. Is there any public present that would like to speak to a subject that is not on the agenda this evening? Hearing none, we'll move on to the consent agenda. The approval of the October 27th meeting minutes. A motion would be in order to approve the minutes. Motion by Lynette, second. Second by Eric. All those in favor?
Aye.
Any opposed? Motion passes. Approval of warrants. You receive your warrants through the Grcsu email. Questions should be directed to Lewis. A motion would be in order for approval of warrants.
Make a motion. I'll second it.
All those in favor?
Aye.
Any opposed? Motion passes. Superintendent's report. Chris?
Thanks, Lisa. Most of you have heard a lot of this before, so I will just kind of skip to the highlights. There is an overview of the COVID updates in there that was as of last Friday. I want to talk briefly about Test to Stay. So Test to Stay has gone live in all of our schools. Some of our schools have had to use it this week. I know that I've been talking with Lisa and the building admins as well as school nurses, that things have gone relatively well. There were some hiccups early on, but with each iteration each day, I think things have markedly improved. So our goal with this was to get kids back in school. I think we've been successful with that. So I do want to thank the building administrators, Lisa Madison, the school nurses, staff, and the families just for their patience and understanding and help us get through this. So it's been great. It's something we've been hoping for a while. Because I know that's it. The biggest headache we've had really was around the quarantine of students and just having them out of school. So we can get them back into the building. That's been great. The one thing I have cautioned at all of our board meetings is we are also at the mercy of supply chain. That's why right now we have a good amount of by next now antigen tests, and hopefully that will continue. But like I said, if things start to slow up or we start to kind of have limited resources, we may have to pivot with this. So our goal is obviously with younger kids that start to get vaccinated, be fully vaccinated would be a lesser amount of individuals that need to do Test to Stay. But that is just something that we'll keep an eye on. Myself, Lisa, and the building administrators will keep you posted on that as well. Okay. The next thing in here is just talk about the Grcsu strategic plan. A letter was sent out last week to the staff members, to the community members, kind of highlighting where we're at. The leadership team met back in October, late October, just kind of set forth, kind of the dates and the goal and what we're looking to do. There was a letter sent out inviting all individuals in our communities to be a part of this design team. I think it's important to have a representation from each of our communities, a wide representation from covering all perspectives and insights. I think that's something that's very important for us. It's something which we've talked about for a while now, about having a strategic plan, having a portrait of graduate, which really kind of establishes an SU vision in terms of kind of where we're going. And I know that some of the feedback that I've received, parents have been excited because they feel that have an opportunity to provide some input in terms of developing a mission statement, a vision that kind of accurately reflects where we're at and where we want to go. So I'm encouraging all, if anyone's interested in attending, whether it be board members, staff, community members, parents, please do reach out to your building administrators, the schools, or you can reach out to myself or my admin assistant, Christy McGinnis. It is a great opportunity. We have a lot of room for the design team, so it's important. I know that there are 5 meetings scheduled. The first one is December 7th. That will be virtual. The ones after the holiday break in January, we will be kind of seeing where we're at in terms of with COVID and our communities, and we can pivot to it in person if we feel it's necessary. So, okay.
I'm reaching out to you.
Thanks for that.
What kind of response have you received? Do you see a substantial cross-section, or do you see it concentrated more?
It's been relatively slow right now. I think and I think that's something which we are identifying other areas. I think the building admins are going to be sending something out. We're looking at Front Porch Forum. We're also looking at other social media. We are going to be looking to place an ad in the newspapers as well. Just kind of highlighting this is the work we're going to be doing. Just trying to reach all aspects. Traditionally, we'd like to have as many people as possible, but our goal really is to find a balance, whether it be community members, parents, students, staff members, board members. So that is our ultimate goal. So as we start to fill this out, we will look to, we maybe reach out to individuals as well, just to make sure. But we want to make sure our goal is to have a balanced group. So it really is just be dominated by one community or another.
Right, that's a big concern. And then also the criteria that people will attend every meeting. I mean, only having
they have
5
to, right.
meetings.
Yeah.
It's really important to attend each
correct.
meeting, otherwise.
Well, you have the
it is
first one.
skewed.
Well, the first
one
design
was-
team is
Yeah.
not taking.
There are 5 additional.
There are 5 design
okay.
team meetings, which
Good.
is for this
Okay.
large stakeholder group. And the first one is December 7th at 5:30. So.
Yeah, the meeting in October was just kind of an overview, meeting him, meeting
Yeah, I forget. I had a
building
conflict. couldn't be there.
admin. Yeah, I joined virtually, yeah. I think you were here, right?
Yeah. So.
I know. I think it's going to be great. I think it's going to be a huge advantage for all of us and start to streamline a little more of the things we've talked about and will help then streamline curriculum and all of those kinds of things.
I hope parents, community members really
So
get
do
behind
I.
it.
This is your time. Don't stand on the
Exactly.
sidewalk and just pray.
Policy, yeah.
Come to the meeting and share.
And you have a problem. Yep.
And you will see elements of the recovery plan, which Lisa will talk a little bit later, embedded in the strategic plan as well. They'll kind of go hand in hand. So it will be, it'll be a nice kind of marriage between the two. The last thing, well, I guess I had 2 more things. The winter sports updates, everyone should be aware of that. We are allowing spectators in our buildings. The big thing is that everyone will have to be properly masked. It's just over the nose, mouth. I know that for some that's an inconvenience, but like I said, it's an opportunity to get back into the facility to watch your child, your neighbor, your niece, nephew, grandson, where they might be. Watch them participate, whether it be in a sport or in a play or a choral concert. That's one thing we're asking is just that people will mask up. Another thing that will be a concern is just food or drink. We're not allowing food or drink in our facilities, and that's just because of the masking concern. So most of our games really are relatively short, so I think we can all go without popcorn for a couple hours. If you need some, I'll have some popcorn here. You can stop by and I'll pop you a bag.
Well, you could stay home and watch it on Huddle too.
Well, I was going to say, watch it live stream.
So
We
that's
do have
the
that
other
opportunity as well,
bonus.
so.
Yep.
And just the last thing is about SBAC reports. So individual reports should be coming out. Some of you may already see them. Others will be receiving them in the next couple days during conferences. So the group report is still embargoed. Lisa, myself, and Al Gregorich will have a report on that probably after the first of the year for the boards as we look at the group reports. So we'll have a little more of that. So.
All right, any questions for Chris?
I have one. Back to the test to stay, it
Yes.
says only unvaccinated students ages 5 and up will participate. Is this because of the limited supply of test kits?
So are you asking about the kids below 5, like our pre-K? Or what do you?
Yeah, it says only unvaccinated students.
Right, so, yeah, so
5 and
that's
up.
the Department of Health, is only unvaccinated students will be eligible for test to stay, correct? Yeah, and we, talking with Lisa, we've also have identified pre-K as also being eligible for test to stay as well.
Yeah.
Yeah, so that, the 5 load doesn't reflect that, but we are offering that in our schools, so.
Chris, this is Kristen Ross. Can you just remind everybody that they need to sign up their student to be eligible for that? Regarding,
Yes.
we're sent home in emails, but just to sort of plug that again. just in
Yes.
case people have ignored emails over the
Yes.
last 2 weeks.
Sure, Chris, thank you. That's a good point. One of the things we are finding, ourselves and other SUs, is that, a lot of parents will wait until there's a need to sign up. And, so all of a sudden they get a phone call like, oh, I need to sign up. There is a bit of a lag in the system, and I think Lisa could talk a little bit more about this. She's worked more intimately with this than I have, but there's like typically a 24-hour lag. So what we're encouraging individuals to do is to go to the Simple Report. There is a link. If you can't find that email, reach out to your administrators, to the school nurse. They'll have that. Lisa or myself can get that information to you as well. But I would be proactive with this, because like if I got a phone call tonight and I try logging in, you would not be in the system until, I guess, Friday morning would, so technically my child would not be able to participate in test to stay until Friday. So it's not this quick turnaround. So
So
I
you
think,
can't just, when you wake up and your child's coughing or whatever, you can't take them to school?
correct.
Okay, because I don't think, well, I know one that doesn't understand that, but, okay.
I mean, so the test to stay really is for identified close contacts. So the school would have contacted you, let you know. We're not operating a health clinic where it's just come on in if you have a cough. So if, the administrator, the nurse has contacted you and said that you have been identified as a close contact, you can come in for test to stay, and you've done the consent form, then you're eligible. But, and that's the information. So I know some parents have asked, well, I didn't know if I signed up or not. And I know that, and maybe Lisa, in your report, you can talk a little bit about the confusion that people have had about sign up for surveillance testing as opposed to antigen testing, and just making sure to kind of clarify that. So, but I do encourage all parents to be proactive, sign up just in case it's there. And it is a voluntary thing, so you don't have to do this. We're not testing students that we don't have a consent form. So if a family says, I do not want my child to participate, then they will have to undergo the regular quarantine as they normally would prior to the test to stay. So thanks, Kristen, for reminding me.
All right, any other questions for Chris? All right, thank you, Chris, and we appreciate you being here again with us this evening. Chris's 3rd meeting this week thus far.
I'll be here all week.
All right, Lisa, Assistant Superintendent's report.
Good evening, everyone. Kristen, I'm really glad you asked that question, because it was one of the things that I was going to emphasize also. In our first few days, we have seen a number of cases where families are trying to sign up at night and bring their kids in the morning. And it just, the system is not designed for that. It's on a 24-hour upload, and things do not always come through that quickly. So if you are a parent who is interested in having this option for your child, if they are identified as a close contact, I would echo Chris and just ask that you try to register in advance. You can also communicate with your school nurse, and they can let you know if you're in the system properly. Unfortunately, we're not in charge of any of this software, and we're not involved in the design or the programming, but you don't get an automatic confirmation when you enroll, which is a really big flaw, I think, in the system, because then families don't know. They're just not sure if their child is set up or not, and the only way you can currently confirm that is with your building principal or your school nurse. Obviously, if there's a positive case in your child's school, those 2 individuals are incredibly busy, and their ability to respond to your email right away isn't just not going to be there. They're going to be focused on contact tracing and ensuring the health and safety of the students in the building, and making those plans for test to stay. So I know they'll do their best. I know one of our principals was emailing families until 10 o'clock one night earlier this week, trying to communicate that with them. But it really is, we just really need that to be done ahead of time. Going back to what Chris said about the test to stay being available for pre-K students, we were able to confirm that with the Department of Health and additional communication with them. That is only for the antigen testing part. of the Test to Stay program. We have two parts of our response testing. One is the antigen test, which is the rapid test that we can do in the morning at school, and the second is the PCR test. That is for vaccinated students or staff 3 to 5 days after they may have been exposed to someone with COVID-19, so that they can just confirm that they are in fact cleared after that case. So pre-K students are able to participate in the daily swab for antigen testing, but the PCR testing, they are not. Right now they're not eligible for a vaccine, so that shouldn't be an issue for any of them. But if you have some that are turning 5, that may be a concern for their families, because 5-year-olds can participate in PCR, but under 5 cannot. So we'll communicate with the pre-K families around that situation if and when we have a case that requires them to come in, or would make them eligible, I should say, to come in for Test to Stay. I also just want to echo Chris with a huge thank you to our nurses, our building principals, and the entire staff teams that have turned out to make Test to Stay as smooth as possible, especially in the schools that have had a large number of students to test. We have tested 260 students in the last 3 days for Test to Stay, which is a significant number for a brand new testing program that everyone is just learning how to run and operate. So we know there were some delays initially in some of the schools. We feel like we're working through most of those and getting the process quicker and quicker as we go, but we appreciate the flexibility of our families and also of our teaching faculty for making that happen. And really everyone is pitching in. There was a custodian that was helping to supervise children and reassure them and get them back to class when it was their turn to leave. There was a primary grades teacher who came in before school started and made sure that she went through with every one of her very young students to be tested, so that they would feel confident and safe and like someone was there with them if they were anxious about it and had never done it before, which for many of our young children was true. Just so many people on our team, our staff teams, that are stepping up to make that possible. But that's 260 children who did not miss school this week because of this program, and that for us is it's such a huge thing. We're really excited about it and hopeful that it will continue to work smoothly, and that we'll be able to continue offering it as long as it's needed to keep our kids in school. Beyond that, I think you have my report, and we've been really focused on Test to Stay, so I don't think there's very much new from me in the last couple days since you received my report, but I'm happy to answer any questions that I can about the program or about anything in my report, as always.
Questions for Lisa? Eric?
I just wanted to ask about the continuous improvement plans.
Yep.
We'll be seeing at least, the GRCSU or even at local districts. I don't know if local boards are seeing those or.
Yeah, we will. It'll be later in the year. We don't need to turn them in at this point in time. Everyone has updated plans. They're not an annual requirement for submission to the AOE. So we look at them annually at the school level and update them, but we don't have a specific deadline from the AOE, so we can work through that over the spring. But yeah, they'll be coming before everybody before the end of the school year, but probably a little earlier in the spring than that.
Okay. I mean, could you clear up my understanding on that? Because I thought that there were changes to the requirements to that because of COVID last year, and so they weren't required, and then they were again, so I don't know.
Yeah, so, gosh, Eric, you're making me go back chronologically, and I keep losing the time with COVID and trying to trace that backwards. I'll see if I can dust off my brain cells. But prior to COVID, or maybe I think the first year when we closed in March, that year, all of the schools had gone through a very rigorous, in-depth, comprehensive needs assessment program and had developed updated continuous improvement plans. Many of them had, work that they had been focused on for some time, but they had revised their goals, adjusted them, added a next level to them, or used new data to refine them. And then last spring, Normally, we would have just done a review of those and made small updates and adjustments to those plans, but the Agency of Education waived them because we had to submit the recovery plan. And so that was the plan that we put together last spring that included the needs of all of our schools and the goal areas of work for them. This year, the agency is trying to create a template for us that somehow merges the two. We have yet to see that template. They're trying to, I think, figure out what it is exactly that they're going to require us to do or submit. So when I know more about that, I will let you know. But it's a work in progress at this time. There are a lot of requirements in the federal law related to the title grants about things that you must have schools include in their plans. And then the agency understands that they've also included a lot of requirements for us in what has to be in the recovery plan and the progress that we're required to show on that. So I think they're just trying to be thoughtful and mindful about not making us commit to so many things that we dilute our efforts, trying to be too wide and not deep enough. But yeah, so we don't really know. We don't really have a timeline. We don't really have a template. We know there will be some adjustments to what we did 2 years ago in terms of the format and content of the plans, but we don't really know what those are yet.
All right, thank you.
Any other questions for Lisa? All right, thank you, Lisa, very much. And Lisa will be coming to us in December with an update on the recovery plan, and she was willing to have brought it last month or this month, and I pushed her aside because we have budget conversations, and so, and hopefully this evening we will put that to bed, so we'll be back on track with having those kinds of updates. And how, and we'll talk about in December, we briefly discussed receiving those updates in a little more timely fashion. We've been doing it quarterly, but things are moving, and just so everyone stays, a little more involved. And I know when I get stuff quarterly, sometimes I forget what the last quarter was. So we've had a conversation about that, but we will definitely have that next month. So thank you very much, Lisa.
Thank you.
Moving on to personnel, contract recommendations. For professional staff, we have 4 positions, all in West Rutland, after-school tutors through the CFP grant. We have, I'm going to butcher the first name, Carrie Simonetti, Karen Ames, Mary Ojala, Marie Combs. And for support staff, we have Lindsay Bowles at West Rutland, who is a para. Are there any questions about those recommendations?
Make a motion to accept.
Second?
A second, but I have a question.
Okay.
These tutor positions, are these are all teachers, right?
These?
That are doing this?
Yes, they're either teachers or retired teachers.
Yeah.
Okay. All right. I'm just curious if, this might sound like a silly question, but I'm just wondering why there's 4 of them.
So who would like to answer that? Lisa?
Sure, I can talk about that. So the way that these tutors interact is with students during the after-school program. So they're able to provide supplemental tutoring after school based on academic need and some specific criteria. So this tutoring is designed to be one-on-one. It's really focused tutoring for students, so they can only see obviously a certain number of students in the after-school period. So having multiple teachers, multiple tutors allows them to see more children during that period of time.
Okay.
Is this being offered at other schools, or is this based on a requirement or criteria at West Rutland?
It's currently available in all of our schools that have a Tapestry after-school program.
Okay.
Although we have been having some conversations about whether or not we might be able to expand it to other schools based on need. We have to have some conversations around and potentially do a grant amendment to be able to do that. So we're still trying to figure out if we can, but we know for sure that our Tapestry schools are eligible.
So is it happening in all other schools that have Tapestry programs currently?
I think West Rutland is the first this
Okay.
year to launch it.
That's what
It was available in the Tapestry schools over the summer, and many of them took advantage of that. And right now, as with everything else we're doing, finding staff who are interested in working for those programs, either staff or community members who have the qualifications, continues to be a challenge. So I think people are recruiting based on student need and the data that they have in the beginning of the year assessments. And hopefully we'll be able to fill some additional positions in some of the other programs as the year goes on.
Okay, and is this something we think we'll be doing then again over the summer?
Potentially, yep. I think we're looking at, there was a shift in how this operated. Previously, the Tapestry program was contracting the tutors and hiring, recruiting, and contracting tutors, and they were struggling to do so and to meet the needs of our Tapestry schools and students in the way that we hoped. And acknowledged that they were struggling to do that also, and thought perhaps that our school leaders and school communities with their networks and relationships might be able to more effectively get people to commit and say yes and be part of our program. So it was just last spring that this was turned over to us for the summer for the first time, with us being responsible for this element of the partnership. So we did this past summer, and we'll work through this school year. So I think we're going to monitor it and see if we feel like it's, the program is effective, it's changing outcomes for kids and meeting the needs of our schools, and is, an investment that we want to continue. If it is, we will try and have it funded through the CFP again for next year.
Okay.
And that would be for next summer. The CFP starts July 1st, so next summer's tutoring would be based on next year's CFP.
Okay, and so in anticipation of that, have we reached out to Castleton, or I just think about the number of students that we've graduated from our 3 high schools that I know are going into education, some in second, third year. I would certainly think they fall within the criteria of being able to assist some of these students. I don't know what the network is that we're using to reach out, so I feel like sometimes the network, when we reach out, is a little too cloistered, I guess, and that it's not really branching out, because I think within our communities, I could sit here and probably spit off 10 retired teachers. So those are the kind of people that we're looking, and then in addition to kids that we've graduated that are in college that are, focused on this. So
it would be wonderful for people to outreach. I know that the schools tend to promote these things within their communication network. So anything that board members see from school communications that they can promote in the community is great. In terms of who could be eligible as a tutor under this system, the CFP funding comes through our title programs, and Title I requires people to be highly qualified teachers or have a highly qualified teacher status in order to use title funds to provide services for students. So in this case, we would need people who are licensed educators or have a comparable license area that we could use for tutors. We're not able to fund like high school or college students with this particular funding source for that kind of service.
okay, that's good to know. Thank you.
Can I tap on to another question that's not exactly the same, but sort of related about and I'm not sure we can talk about this in a different place, or is thinking about salaries for things like paras, in terms of comparable salaries. I just know a few folks who have been out of college a while looking to go into teaching, have some like early childhood ed background, et cetera, that have looked at, well, specifically for us, for example, Poultney, because they're Poultney residents, but just looking at our hourly rate there, and is it,
So I'm going to tell you that that's an inappropriate conversation to have in public session because we are currently entering into negotiations. If that's something you want to discuss in executive session, I'm happy to include that at the end of the meeting, but that's not a conversation I'm going to entertain now during open
Okay.
session.
okay, sure.
All right, are there any other questions for Lisa about this? If not, we have a motion and a second. All those in favor?
Aye.
Any opposed? Motion passes unanimously. We have 2 resignations before us. One came in later. The first one is Morgan Washburn, who was a para at Proctor Elementary. Oh, we only have 1 resignation, I'm sorry.
request.
The second one is a leave request. So we'll take action on the resignation first.
Make the motion.
Motion by Mike, second.
I'll second it.
Second by Tina. All those in favor?
Aye.
Aye.
Any opposed? Motion passes. The second is a leave request. And Chris, do you support the leave request?
Yes, I'm fine with this lead request.
All right. The leave request is for Caitlin McCoy for maternity leave from, she's anticipating December 20th to March 18th. A motion would be in order to approve the leave request.
Eric made it, I'll second it.
All right, all those in favor?
Aye.
Any opposed? Motion passes unanimously. You also have in your pocket vacancies that are open throughout the SU. Lewis, you're up.
Good evening. So I have a few things on the agenda. First, let's handle the van replacement. So at last month's meeting, I brought up this topic regarding the van replacement. There was a special ed van that was originally stationed at Proctor High School. And it was moved to West Rutland based on need. So West Rutland was using it, and it was in an accident in October and totaled the vehicle. We received a check from the insurance company in the amount of approximately $9,000, and at the time I was looking to purchase a used vehicle with a mixture of funds from both that check as well as Corey Valley general fund funds, because the vehicle is going to be stationed at Corey Valley. At that time, there was concerns that were brought up by the board. I've had additional discussions with administration, and we are moving in a different direction. On Monday night at the Corey Valley meeting, we discussed the possibility of buying a Corey Valley vehicle, general fund vehicle, and I'll continue to pursue that with the Corey Valley board. As far as the special ed, we still have 1 special ed vehicle, which is currently stationed at Rutland Town. It is also an older vehicle. I believe it's a 2010. I'm not positive offhand. I'm working with Christine Ham to look at purchasing 1 or 2 new vehicles out of a new special ed grant that we just received, which is IDB ARP funds. It's a one-time grant that we're receiving to the new ARP funds that have just came out. Not ready to present that information at this time, but looking to present that at a future meeting, possibly January.
Great, thank you.
The next item is ESSER. A little earlier today, email came out with an ESSER report. This is an updated report. It's 2 pages. Yesterday I had met with the executive committee and we went over the budget and the forecast of ESSER funds for the next few years. The first page of the report looks similar to something you've seen at a prior meeting. It's just a budget and actuals for both ESSER 1 and ESSER 2, as well as some descriptions on what's falling into each of those categories. Page 2 looks more as a projection for ESSER funds over the next 3 years, looking on how we're going to spend both ESSER 2 and ESSER 3. This is still just a working document at this time. As we bring new positions to the board or new expense new expenses to the board. We'll continue to update this. We'll talk about some of those positions during the budget conversations in a moment. Any questions regarding that report? Okay. If not, we'll move on to budget. So last month we looked at the first draft of the SU budget. Tonight we're looking at the second draft. Just one thing that I'd like to point out, just an error that I found was on the second draft, just at the header at the top, it is the second draft, but I did not relabel it as second draft on the report that went out in the packet. So looking at the first page, the summary of changes. There weren't many changes since the last board meeting. There wasn't a lot of board feedback or direction to make changes. So what is included, the biggest change was we had originally estimated a 10% increase in health insurance premiums. Since then, we've got revised guidance from VSBIT, and we believe now the insurance premium is going to increase by 5.2%. So that's going to affect a few different areas of this budget. At your local boards, the guidance that I received was after the SU meeting, but before, I believe, all of your local meetings. So your local budgets did reflect the 5.2%. So the change from 10 to 5.2 resulted in a $9,000 decrease in the budget for the general fund, a $35 decrease in the budget for the special ed fund, and a $5,000 decrease for the special ed disallows. The only other change was based on the executive session feedback at the last board meeting. There was $18,000 in changes in insurance, in salary costs, insurance and benefits and salary costs. So currently, no change to page 2, which is the assessment allocations. Looking at going on to page 5, the general fund is currently down by $41,000 or 2.5%. So that's the assessment. Expenses up by $102,000, 5.9%. Assessment is down by $41,000, and that's due to a decrease or an increase in revenue. And then you can see at the very bottom of page 5 your assessments and how each district would be affected. The next part of the budget is special ed. Special ed totals are on page 9. Currently, the special ed budget is up by $121,000. That's 4.8%. And each of the assessments is below. So Corey Valley is increasing by approximately $33,000, Wells Springs by $38,000, Rutland Town by $40,000, and Ira by $9,000. So we talked a little bit about this at the last meeting. The percentages are not spread evenly across the districts, and that's because of the change from one year to the next in the number of IEP students for each district. So if you go to page 2 where the assessment allocations were, you can find your percentage that you were paid last year for the assessment versus the assessment percentage that you're paying this year. And then page 10 is just an information sheet on the special ed staffing comparison, as well as the special ed disallowed comparison. As we talked about last meeting, the new positions that are currently in this budget, there was 3 that we talked about at the last meeting. 2 of them are part of the special ed budget. There's 2 behavior interventionist positions that we're currently proposing to fund those out of ESSER funds. Those would work at the SU and serve all schools. And we funded those through ESSER just so that because the special ed budget was already up, so that would have a smaller impact. And just to refresh everybody's memory on the special ed budget, and one of the main reasons why it's up, and you can find some summary of changes. Next year is the first year that we're moving to Act 173. which eliminates the reimbursable special ed model and goes to a block grant model. And based on this switch, we're losing approximately $181,000 in revenue. So those two behavior positions are included in this budget. There's no budget impact because they're projected to be funded out of ESSER. So we'll need to discuss that and see if we can get approval for that. And then the other position we discussed was a substitute coordinator. I had proposed funding that through ESSER. That doesn't, as we discussed last meeting, it doesn't necessarily need to be funded out of ESSER. We could fund it out of Kelly Services budgeted money. It should not, we're looking at a full-time position at first with the hopes that we can reduce that position after we get it started. This person would start the program in-house, work on recruiting, onboarding, work with subs, working with buildings to get the project up and running, and moving away from Kelly Services and bringing our substitutes in-house. And then the only other thing that I know was discussed last month, and I believe he has more to discuss tonight, was the technology. And so I'll hand it over to Greg. We'll take questions after that.
Hello, everyone. Yeah, so I want to make two recommendations. One is to add 2% more to the already 3% regular salary increases for the technician staff. So that would bring them to 5%. Although this doesn't really match salaries for qualified technicians in our area, I mean, it will do something as a preventative maintenance to have them leave to better jobs. Well, not better jobs, but ones that pay higher in our area. And there is a very much a hiring.
This feels like this should be.
I don't know
Should
what
be.
to call it.
This is an executive session matter, Greg. Are you going to be discussing anything else that is current personnel that we have?
It's not an executive session matter because I'm merely adding this to the current budget. So it is a budgetary discussion. I'm not identifying anybody personally. This is a level of technician that should be paid higher, or else we may lose those technicians. So it's preventative and it's budgetary.
Inappropriate.
It is. Nope.
Greg, I think you should concentrate on the other piece. I agree, that should have been discussed in the executive session.
Okay. The next thing is adding another technician to our staff, which in discussing the budget numbers today with Lewis, depending on their insurance is based, what was the number that you gave me, Lewis? It was
For a full-time position would be approximately $75,000 with benefits.
Right. So that's what I'm requesting be added to the budget, which was removed from the budget during the COVID times, which was in there and approved last fiscal year, which we never hired at that position.
Is it in the current budget, Louis, in this draft that you just gave us?
It is not.
Thank you. All right, anything else, Greg?
I have a question.
Well, that's it. I mean, I gave a little cheat sheet about, what we're facing and what the environment is facing. And my recommendations are to increase their salaries and to add another technician. That's
Okay,
preventative maintenance.
Mike has a question for you.
Greg, would you be able to demonstrate by data why you need a new technician based on current labor requirements? Be nice to see some data why you would need this. It would have to be pretty comprehensive too.
Well, was there something that wasn't clear in the amount of tickets being serviced and the amount of programs and devices that are currently being serviced in the
Right.
last
I-
sheet that I gave.
Right, I saw that, but I would just need you to demonstrate better to me why this position would be needed.
We can move part of this conversation to executive session about existing personnel, and I think we had, there was a brief conversation with you about that. I'm not going to go any further than that right now. So is there anything else that you want to share with this in public session?
Not as such, but
Okay.
I don't understand why, based on that other sheet, that you don't think that there is a higher workload. What kind of information would you be looking for as far as that we're all occupied all parts of the day, every day? I'm not sure what data I could give you that would satisfy. So what type of data would you want? I mean, I gave ticketing data, which is, which shows an average ticket amount in the dozens per week, depending on the length of the execution of that ticket. Some things can take, an entire day. Some things can take 2 minutes. I'm telling you as the administrator that there is work for this person. I'm not sure what kind of data you're looking for, and maybe if you gave me that, I could send it all out to the board for your perusal. But I'm not sure what kind of data that would satisfy that request.
Well, I'm not sure what to ask, Greg. That's why I think you need to demonstrate it to us. It's not the reverse way. You're asking us, so I think you need to provide the data for that.
Okay, Louis, is there anything else in the budget that you want to discuss? The administrative travel stipends, that was something else. Did you have a dollar amount you wanted to assign to that? And if assigned, how many people are we speaking of?
I don't. I know in the discussions that I've had with the people that it would pertain to, I think it's 3. And they were looking to maybe take their average travel over the last few years and to develop that stipend.
So are you looking to do that monthly, quarterly, true up at the end of the year, 6 months? I mean, I need a number. I mean, are we saying 3 people at $300 or $100 a month, 3 people at?
I think it was 3 people, and I don't have those amounts. I'd have to look at what their travel is. I think it's going to be different for each person. I mean, the net budget impact should be a wash because you're getting the stipend in lieu of the reimbursement. So it's no budget impact. It's just the concept.
Is it a cost, is it a time-saving measure?
It is a time-saving measure for those people that are traveling. For example, and I'm thinking for people like Lisa and Chris and Greg who are traveling to numerous schools in a day and traveling every day. And so it's a time-saving measure for them to sit down and accumulate all that data into a reimbursement form.
Okay. All right, that's good enough. Any questions from anybody else on that?
Can I make a comment towards Greg? Greg, I think part of our problem is we don't have that paper in front of us that you gave us last meeting that had all that information. And I also kind of remember you saying that these are just, some preliminary information, and I'm going to go back and look at some creative ways to see what I can do and some other options besides just hiring more people. And so I think what Mike was trying to say is, did you go through that, and what was that information, what were those things that you thought about doing? And then the other thing that I was also wondering about data, I know in the medical field, one thing that we do that says maybe we need another provider or need to change something is when our wait time is drawn out for a long time. So maybe a piece of data that would be helpful is how long does it take for your technicians to get and complete a ticket? And that information may have been on that paper you gave us, but I just don't remember what that answer was right now. But that would be helpful to know what the average wait time to complete a task was, or a ticket.
Well, our wait times are very good in general for, I would say 90% of the problems that are not related to larger infrastructure problems where we're dealing with a software company or we're dealing with hardware that needs to be repaired and things of that nature. I guess the cheat sheet, I had put data in there to show staffing levels at comparable institutions in education, and I used Rutland City and the SVSU as examples based on their budgets, and just to see that with a comparable size, we're dealing with less than half the staff that they have. And so I thought just logically, and the amount of tickets that we're dealing with, and the amount of programs, and the amount of actual physical devices, that would be enough information to say, we have a lot on our plate on any given day. And one technician per 3 buildings, where that does seem manageable, but a much more reasonable staffing level would be to have one person per 3 buildings and then have another technician that can assist the other technicians and not pull Milt, me, Shannon, other people to kind of do 2-man kind of jobs like that. And so, like, I mean, it was just common sense kind of a cheat sheet, just showing the broad numbers of staffing levels that were in comparable districts. And that was and I guess that wasn't a good selling point. And I guess I didn't make my case big enough. But as someone who sees the ticketing system chugging by, and, you know, I'm a very candid person, I'm going to say that things would just run a lot smoother if we just had one more person. And if, you know, we can protect our staff from being pulled to other institutions. That's all I'm trying to do is preventative medical maintenance, as, you know, as you use the healthcare example. I can provide more data. I have to see how that would be, you know, acceptable to show the levels. But right now, from this month and next month in particular, our tickets are generally very low. It isn't really until January gets chugging or there is an initiative in the SU that it becomes apparent that we don't have enough staff. Like, it's obviously the crunch times and things like that. But there's also additional things that we could do to change the infrastructure, make it better. And that's the kind of time we don't have to sit down and say, and to plan out new initiatives that run things a little bit smoother, because we're just dealing with the day-to-day. And that's it. That's my point.
Thank you very much, Greg.
Thank you.
All right, Louis, anything else for the budget?
I have nothing else to present.
All right, I think that some of the conversation we need to have needs to be an executive session because it revolves around personnel. I would not, and these do not, because these are new positions, so we're not talking about existing personnel. I would not support funding the substitute coordinator out of ESSER funds. I think if you're creating a position that you intend to have going forward, that it is irresponsible to fund that out of ESSER funds, and it is not true to the budget. And then in a few years, when these ESSER funds go away, it's going to make it look like you have some kind of surplus, because then the Kelly money is just sitting there and you're going to end up doing something else with that money. And then when we have to fund this, chances are the Kelly money will have already been reinvested into some other kind of personnel. I would prefer, if that's the direction of the board and that's what we're going to do, to use that Kelly savings to fund this position. Lynette?
Typically, I would agree with you. Coming from Rutland Town, we used to have our own person that would hire substitutes.
Right.
That became very time-consuming and unmanageable. I would like to see it stay with Esser for at the most 2 years, just to see if it's going to be viable. Because trying to take or replace Kelly Services, what they're already doing, it's a huge task. Number one, just trying to find the people, the substitutes that whoever this person is could line up and set. I don't know. I don't know if it's doable.
Well, I think we're gonna have to commit to this or not commit to it, because in order to do it, we're going to have to invest in other software, and there's other pieces other than just hiring this coordinator. So it's either we're going to commit to it this coming year, or we're gonna stay with Kelly. I mean, that's been a concern, and I raised that at the last meeting, that if Kelly can't do it and find people, what's our magic potion to find them? And maybe we have one that I'm not unaware of, but that seems to be the biggest issue. Now, Lewis said that part of the problem was the time it takes Kelly to onboard, and if we did it in-house, we would cut that time, and that would be, would, Lewis, you thought, be a benefit, because that would bring people on quicker?
Yes, that was one of the benefits. I mean, I think the staff shortage you're gonna have, whether we're with Kelly Services or bring it in-house, that's an issue that we can't overcome just by bringing it in-house. I mean, we have to hope that the job market improves over the next year or two. The added benefits were the bringing it in-house is we have more control over the onboarding, we have more control over the day-to-day operations. And right now, we're paying Kelly Services a premium, 45 cents on the dollar, to handle all that, and they're just not handling it well. So it's putting the control in our hands, having someone who's going to be a liaison between the buildings and the sub pool, and working on it on a daily basis. I did meet with area business managers today who have gone through this process and are all handling it in-house, and they felt like at first you'll probably need somebody to handle the transition, and to actually, if we're looking to do this for next year, we would probably need to get this started before the year starts, because we want our pool up and running before school starts. But they said after it's up and running and you have a software in place, which would be the software we're using now with some added features, that you probably wouldn't need a full-time person to manage it going forward. So potentially decreasing that to a half-time person down the road in year 2 or 3, depending on how long it takes it to get it up and running.
Lois, I have a question. Those schools that your other managers are talking about, are they comparable size districts to ours, SUs?
Yep, so I think we're one of the very few, I mean, it's only, I think, less than a handful of schools that are currently using Kelly Services in Vermont. So the business managers that I spoke with today were Rutland City, Rutland Northeast, Slate Valley, and Mill River.
Okay. But if you talk about those schools, they don't have the distance between schools that we have. For example, us to Pulteney, us to Wells, whatever. They're more centrally located. Correct?
I know. I mean, Slate Valley is more, and I think Mill River more around a center. I'm not sure about Rutland Northeast, and definitely Rutland City is more centralized. But this person really wouldn't be traveling a lot.
No, that's not what I'm talking about. I'm looking at the logistic part of it.
As far as the building the sub pool?
Well, yeah, because when you said that in maybe the second or third year, it would go a lot the coordinator may be not necessarily full-time. I have some personal experience with this and know that that's generally not the case, is that load doesn't really change. The change that we're seeing now is because of COVID, okay, so that may reduce it some, but it's almost a data that you can drive, if you look at it over a couple of years, excluding COVID, as to the ebb and tide of when you need substitutes. It's almost like, it's almost data-driven. So
Well, you're gonna need substitutes all year long and every day, but the person who's being the coordinator, I mean, the initial work would be building that sub-pool and onboarding those employees. Once you have the pool started, I mean, you're gonna have new people coming in and people leaving, but it shouldn't be as big as the immediate rush, and going out there and recruiting.
the pool, I'm not talking about the teacher pool so much as that you cannot predict the load that's going to be required because of what may be going on in the teachers' homes. You know, you can project an absentee due to a class, training, caucus, or whatever it may be. You can project those things. What you cannot project is when teachers have children at home maybe that are ill, or a spouse gets ill, or something just comes up. So it's not a static, I guess is what I'm trying to say.
I think I understand what you're saying, but that wouldn't affect the coordinator's time. The coordinator.
Well, it would if.
Once you have a system up and running, and we will have a software that runs it and manages it, it's just really somebody that gets the process started and builds procedures, builds a system, works with the schools on how it's going to work. Like I said, initial recruiting and onboarding. And then once that system is up and the procedures have been built, it's just managing it going forward. So you have increases and decreases in the amount of subs you need on a daily basis, but that would not affect the coordinator's time. The coordinators wouldn't be in building subbing.
No, I understand that, Louis, but, you know, I guess I'm going to have to wait to see what the process is because, you know, are we going to be calling this coordinator at 9:30 on Sunday night? Are we going to be calling that coordinator at 6:30 on Saturday morning? I think that's part of the process that we need to look at, and we can't take it for granted quite yet.
You wouldn't be calling the coordinator in those situations. You would be accessing the software.
Meredith,
So
yeah.
it's similar to the way it works now, is where they go on to Kelly Services software and they record the absence, and then the subs that are on the pool would also go in and fill those absences. So there's no calling like maybe in the older days where you actually had to call people that morning looking for them. I mean, there may be certain situations like that, but that's not the norm.
Well, I think you need to talk to Rutland City again because my wife gets called practically every morning, and that's what she does. So that's not completely accurate. And she's not the only one that's probably getting called.
Meredith?
So over the years, this question has come up repeatedly, and so what I'm understanding, Louis, is that is it the software primarily that's tipped the scales for why this is something to consider as opposed to in the past? It usually hasn't been something you've supported in my recollection.
That is correct, and I think April just put it in the chat. But so we use Frontline for our absence tracking, and that's what all of the area business schools also use Frontline, or most of them, maybe not all of them. So I haven't supported this in the past because I mean my philosophy is this is Kelly's wheelhouse. This is what they do. Why take it from them and add a burden onto us when it's not something that we do on a regular basis? So it's sort of like transportation. We outsource that because that's their job. They know the ins and outs. They know how to run it, and it's easier for them to do, and for us to just contract it out. I think the difference in that what's really turning the tides is that Kelly has gone through so many restructuring, and the service has just deteriorated and continued to deteriorate over the years, and the service just isn't up to par anymore. And I mean, it's had its ups and downs, but it's just getting to the point where we can't get answers when we need them. there was another point I was gonna make, but I mean, I think that's the basic, we're trying to really bring it in-house to take more control over the day-to-day. I mean, it's not a move we need to make. It was just a proposal and a suggestion. Going back to what I mentioned earlier, with only a few schools in Vermont that are using Kelly services, they don't have that presence anymore. They used to have a local office in Rutland. They no longer have a local office. And so for them to build a pool in Vermont, in this area, if we're the only SU that's using them, it takes a lot more resources for them. And they're really not committing those resources because we're the only ones using it. If there was 3 or 4 SUs that were using it, they could have a local coordinator that works with Kelly that would do all the recruiting and really work on building those pools. But because we're the only SU, we're not seeing them commit those resources.
I just, again, to go back, I think it's a great idea, and I know the old days versus today, but I'd like to see at least the first year out of ESSER funds, and then still have the Kelly funds, because I think the transition may need both, okay? And then we still have the Kelly funds to help back up if we're having problems getting it up and getting the substitutes. I don't want to shut off Kelly and have an in-house, and then all of a sudden we don't have enough subs.
So you want to run them simultaneously?
Kind of, yes. Basically, what I'm saying is Kelly would be a backup. So if as we're getting going, if we should have problems, we can still reach out to Kelly to see if they have some slots, some people to fill slots that we're not able to fill yet because we're not up to par.
I wouldn't recommend that. We're sort of running it side by side in a way right now, and we have been since COVID started. We've hired those building subs in each of our buildings that have been filling vacancies that have been unanticipated. And some buildings have had two or three part-timers, one have had a full-time. In addition, over the last 2 months, since with the issues that we've had with Kelly, and if we've had people that have called up and said that they've been waiting 2 months to get hired by Kelly, we've said, forget about Kelly, we'll just hire you directly and putting them into buildings as building subs and paying them directly. So we're already working on building that pool. We're not doing it in the same way that Kelly's is by people signing up for subs. We're just putting them in buildings and having them, we have enough vacancies on a daily basis to keep them busy. So we're just putting them in buildings and having them fill those vacancies without putting them open to Kelly.
Meredith?
To me, it sounds like Kelly's system is just non-functional, and as I said before, this is far from the first time this issue has come up over the years, and this is the first time I've heard Lewis speak so specifically about how much Kelly can't perform. I think this is a very important thing to move forward on, and I am concerned about not using the ESSER funds because I appreciate what you're saying, Lisa, in terms of being true to the budget, but this is money that we could use transitionally, it seems to me, to deal with something that is significantly COVID related.
Sure. And the other thing too, Lewis, last time we met, I think when you were presenting this, you also had mentioned the savings that we made for the first 2 years would help pay for it when the ESSER funds were out. Is that correct?
Yeah, so at the last meeting, we talked about the 45 cents on the dollar that we're paying to Kelly that we would not be paying anymore. So if we weren't using ESSER funds, we would be using all of that to fund this position as well as fund the software. If we were using ESSER funds, those savings, I'm just pulling out that document. So the admin costs that we're paying to Kelly right now are approximately $133,000, and of that, about $38,000 of it is going. I would estimate is going towards taxes like FICA and Medi and workman's comp and unemployment. But that leaves about $95,000 that's going to Kelly for their coordination of the program, their profit, training, overhead, stuff like that. So it's that $95,000 that would be savings if we were using ESSER. If we weren't using, I'm sorry, if we were using ESSER, you would have that $95,000 savings. If we weren't using ESSER, we'd have to access that $95,000.
Mike?
I didn't want to leave the impression with you, Louis, that I'm against this, because I'm not. I'm actually highly in favor of it. I guess I just want to be a little bit more pessimistic about the management of it up front. And I do agree with Lisa. I think that we should make it a line that shows what we're actually trying to do, that it's part of our budget, that we're not relying on some other fund to provide it in the future.
I mean, couldn't we use ESSER funds in this current year, as you said, to start the position and start the pool from now till July 1? I mean, we could say we're going to start building that while we continue to use Kelly to complete this school year. But we could say December 1st, or we could say when we leave this meeting, you're going to put an ad together and hire for that position. And for that position from December to July 1, we use ESSER funds. July 1, we've put it in the budget. If we're anticipating this is $70,000, then you still have a savings, because you're saying 95 is what the top from Kelly is. So you still have a surplus from the 95 if you're using 70 or 65. I mean, I don't know.
Now, would the programs, the new programs or additional programs we need to add to the system, that could come out of?
Yes, I don't have an estimate yet on the frontline program. We're using it for absence tracking, but we don't pay for it because it's coming to us through Kelly Services. So I do have to meet with a rep and go through the different features that they have, and not only the feature that we're using, but the other features, and see what that cost is.
I think that would be great to use Lisa's example. Let's, pay it for this first year, but maybe we can also put that, the cost of what we need for hardware and whatever, in that, take those out of ESSER, and then next year, we're in the budget and we're going forward. Do I make sense?
Does that work? If we agree to this position this evening, that starting December 1st to July 1st, we could fund from ESSER the position and the hardware or software or whatever we need. And beginning July 1, for the budget for FY23, we've put that position in the SU budget. We're funding that position from the surplus of not using Kelly.
Yeah, that works for me. I mean, like I said,
It's so easy to know.
It's just a matter of whether you want those savings in your local budget or not. So I'm fine either way.
Yeah, I don't like savings that are here today and gone tomorrow, because I think that makes it more difficult to explain and see the jumps. And I think if this is a position that we're committing to, then let's commit to it. If they're going to be at the table going forward, then let's set a plate for them. Eric?
Where in the budget is the line for Kelly Services?
All through it.
Yeah, so it would be in many different spots. It would be a professional service. In a lot of budgets, it's a 320 line. So you wouldn't see any in the SU budget under the general fund, but you would see some in the special ed budget on page. So the biggest one on special ed would be on page 7. There's 90,000 there for under on the 320 line. It's about halfway, 3/4 of the way down the page. Professional services, 90,000.
Okay. My question is, if we did fund this position with ESSER money next year, would that offset the budget at all? Or would it, were you planning on leaving it the same?
It would not have any budget impact. So my thought is the way I would build it is I would build a separate fund within our SU entity, sort of like special ed and the general fund, they're each a separate fund. So I'd build a separate fund where this person's salary would be, as well as all of our Kelly services expenses. And I really need to think about that more and see how we want to do that. Because you could have subs that are subbing into multiple districts, and rather than having them in multiple payrolls, if we paid them all under the SU, we can streamline that. And so then we would keep track of where they're subbing and then do a bill back to each district or each school on a regular basis, whether it be quarterly or twice a year. We'd have to see what.
That certainly makes the most sense.
Right.
So it would be self-contained, and the fund should net to zero at the end of the year. And so when we build it back, we'd have to shift the budgets at each of the local ones, not the dollars, but the coding. And so it should be a net zero impact to each of the local budgets as well as the SU budget.
Greg, is there something that you could do with a rational database that could put this together for us?
A rational database containing what?
Information concerning substitutes, i.e., name, contact, email, schools worked, open slots. It'd be just a basic database where the manager of the program could go in and look to see where they may be able to fill in a slot, or as maybe teachers could sign in also and say, hey, I'm going to be out. It'd be just a database.
Instead of using online?
Sure.
Well, I was just going to say that was one of the functions that we would have access to with an upgraded finance and bookkeeping system, which we've been in a holding pattern waiting for our orders from the state, which is in disarray. But something like that where a manager of a certain department could see those kind of statistics, and employees themselves can log in, see their hours, log their time sheets and stuff like that. That's all part, and we, managers of buildings can see the gaps in their staffing levels and stuff like that. That's something that would be included in a more modern and, thorough bookkeeping and finance system. But again, we're waiting for that decision at the state level regarding what we can do about that. But we could also do this in a low-key way as far as building managers with simply an Excel spreadsheet with updated staffing levels.
No, I think we're better to have Lewis get the cost for the other half of Frontline.
Frontline already has a product built that's successful. It doesn't make sense to build our own product in Excel files. The Frontline product has many features. Other than we use it for absence tracking, but it can be used for electronic time clock, where everybody just has to scan their card to sign in, sign out, and it can eliminate some of the timesheet work. There's many aspects of it. It doesn't make sense to create the wheel and start from scratch.
Question.
So Lynette calls the question. A motion would be in order to approve the substitute position beginning December 2021, fund that position from ESSER monies until July 2022, and that position would be a line item in the FY23 budget. Is there a motion?
Made.
Would that be in place of the Kelly?
Yes, in place of Kelly. So that's why we would.
That motion.
That's why we would start in December to start to build the pool.
I'll second it.
Okay. Any questions, comments?
Lisa, I'm sorry, can you just repeat the whole thing one more time for me? if you don't mind?
The motion would be to hire for the substitute coordinator position for in December 2021 and to fund that position from ESSER monies until July 2022, while still using Kelly's services for this school year, beginning July, or it should be June 30th, I'm sorry, 2022. Beginning July 1, 2022, this position will have been included in the FY '23 budget. And we will no longer be contracting with Kelly Services.
And it would not, that position would not be grant funded at that point.
That position would be in the budget beginning July 1, 2022.
Got it, thank you very much.
All right,
I have one question.
okay.
Louis, I can't remember 100% sure, but we don't have a contract with Kelly Services, do we? Is it just year to year for rates?
We do have an agreement that runs from year to year. So we would have to give them notification that we're leaving.
All right, thank you.
Any other questions? All those in favor of the motion, please say aye.
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 Any opposed? Is that I'm hoping, Meredith, that's an aye, yes, aye. Okay. Okay. Any opposed?
I abstain.
Motion passes by majority.
One abstention.
All right, so there's one issue off the table. Do we want to speak about the two behavioral positions with Christine? Those would be new positions, so those could be discussed in in open session. I have executive session on the board, on the brain. God. I've been in this room too many times this week. Christine, do you want to give a little synopsis again of why you're recommending two positions and why you're recommending funding them through ESSER monies?
I think one of the things, obviously, I'm coming at it from the special ed, but also if they're funded through ESSER, then they're going to be available to all students. So I think that's important because we never know who's going to need that support. What I'd like to see these positions do is to, when we have either a referral from a teacher or a building administrator that we have a student who's really struggling and that they need support. The teacher may need support, the student needs support. So someone can go in there, they can work with the teacher, they can work with the student for a period of time and help to get things smoothed out, figure out what's causing that problem, what they can do to help support that classroom, that student. So with the aim always being is how do we keep students in class being able to access their education. And that's what we want to do. So again, it would be a period of time and then they can go and support someone else. Because we want to build the capacity of our staff too, not just classroom teachers, but some of our guidance counselors, some of our other supports we have in the building to really work with the students and help support everyone so that we keep students in our classroom. So that's what this position is designed to do, not to be a one-on-one aid or support to a student, but to support those one-on-ones if we do have that, or when it's more not even as high of a level, just to get things back on track so we can be more proactive than reactive to things.
Okay, Lynette?
Christine, now, ESSER funds, of course, are going to go away in 3 years.
Yep.
So what are your plans at that time?
Well, I think that's one of the pieces of building more capacity, building strength. We have had different positions. I do think there may be continued need for that. But I'd also like to see the more we can build capacity of teachers and building staff, that we can back off some of that one-to-one para support too. I mean, that's the position we're trying to go to. We're trying to make sure that, students have the access they need in their classrooms, so they're not either getting frustrated and going out of class or whatever, looking at the supports they need.
So they would not be drawing from special ed?
They would. It would be for all students. I mean, with it going through the ESSER funds right now, that would give that ability for any student to have access to that. I mean, I think, we do know that it will also support students who have special needs too.
Okay, now, but that, when they're doing the capacity of a special ed assistance or whatever, does that period of time get billed to special ed?
It wouldn't out of ESSER funds.
Because it would be grant funded, so it's just one bucket of money.
Students.
Under ESSER.
Right. So, again, and we're gonna see that, I think we're still waiting to really figure out how Act 173 is all gonna kind of pan out in the next year or two after they do that. They haven't really, the state hasn't let us know exactly how they're gonna monitor our spending of those funds. The idea is it's supposed to give us more general use of those funds to support students. But they've also let us know they're still gonna do probably some kind of time study or something. So they haven't verified that, so.
Okay, Eric has a question.
Is there a greater need for interventionists in certain schools or districts? Or is it just pretty level throughout the whole SU? I mean, will these interventionists need to be traveling a lot?
They would be, they would be able to go from building to building. That's why we looked at too, kind of having them sort of some more north and then the south. Eric, the needs vary. We from week to week, from year to year. So you might find a time where you've got a higher need in one building, but that doesn't mean you won't have a need in another building. I mean, right now the people that we have with our SEL coach, she gets a lot of calls and requests to help out. We've also found with the survey that we've done, the SEL survey, we've got some high needs, right? Students are coming back in and are struggling from having been out and from COVID. And I think, we want to have the right support.
So we say behavioral positions, but you're saying behavioral interventionists. How many do we currently have throughout the SU?
Well, we have a halftime one that's funded out of special ed, and that's and there's a halftime position that's funded out of a local budget. There's another full-time position, I think, that's funded out of that's split in Poultney.
Which is local.
Which is local, right. So there's only the halftime that's funded out of special ed.
Okay. So I guess the question for me is, how would you determine what building they're going to be in?
Referral process.
Okay. And we're talking about helping teachers and pushing in and giving teacher support. Are we doing that with paras also? Are we doing that? Are we having these people, or would we have them do that with paras as well?
Yeah, and for a lot of those, it works hand in hand.
Okay. Okay, any other questions? Anyone?
No, I think they'll wait for the third year.
So for those positions, is there, well, what's the pleasure? Do you want to fund two of those positions out of ESSER funds? Do you want to fund two positions?
I would like to make a motion to hire those two positions. Can we do it yearly? Do I have to say all 3 years?
Yeah, they would be, one-year contracts.
Okay. Just because I think the majority of the problems, don't get me wrong, I know there are problems for these people to address. But if a lot of it is COVID-driven, remote access that we went through for the last year and a half, and we're getting kiddies back up on where they belong, we may not need two in the second year. We may need just one. I don't know. But for the first year, yes, anything we can do, because there are a lot of students out there that need extra help.
Right. So, Louis, a question for you. If we decide, supporting these two positions, if we wanted to, because I know these positions are difficult to fill, we've had positions like this open and open and open, could we start advertising for these positions, or at least one position, let's say in December, and do we have ESSER funds to fund that from January 1 to June 30th? Or is ESSER 1, what's gone?
ESSER 1 is pretty much off the table. There's only a little bit of money left there. But I think we do have sufficient ESSER 2 money. We have several positions that were approved earlier this year, which have been advertised and not filled yet.
Right.
And so those are budgeted in ESSER 2. So we could definitely move some of those funds to cover both these positions as well as the substitute one that we talked about earlier. I mean, even if we start advertising now, I mean, it could be a couple months before we fill them. So you're only looking at a part of the year.
So would the,
At least, oops, sorry, I was gonna say, it could give us an advantage.
right, that's what I'm
before Everyone
thinking.
starts hiring for next.
Right, and so, and because our problems are present, they're not waiting till
Right.
August or September. So would the board support, starting the hiring process for those positions, like we did the, coordinator position, putting an ad in December, if we can hire someone to fund from January 1 to June 30th, that we could fund that part of the year from ESSER, but then July 1 going forward, it would also be ESSER funded.
Yeah, I think that's my motion.
Okay. Is there a second to Lynette's motion?
Second.
Any questions, comments? All those in favor?
Aye.
Any opposed? Motion passes unanimously.
Thank you.
All right, I think a couple other things we need to discuss have to be in executive session with the budget.
Not, what about,
The stipend?
I'm sorry. No, I just, you talked and I blew it.
Oh, sorry.
That's okay. Fragile mind. No, I'm talking about enrichment, when we had discussed,
Oh, for ESSER?
maybe we should do that now, because that's not executive session.
No. So the executive committee met with Louis and Lisa and Chris, and we talked about ESSER. And we looked at the positions. Some of the positions, as Louis said, have not been filled. And we talked about enrichment. We didn't spend as much money as we had thought. And we also spoke about, in all of our buildings, there's a class that's going to graduate in some capacity, whether it's sixth grade, 5, 6, combined because of a small class, seniors, or 8th grade. And if you look at this year's senior class, they, other than this past semester, have not been able to fundraise since they were sophomores of their first semester. So a lot of them don't have money. 6th grade classes historically fundraise within the year, as do the 8th grade class. So we had this conversation, we were looking at ESSER funds, and what we would like to do is give each class, with the exception. Each school, yeah, each class. Boy,
Wow.
That'd be a fun, wouldn't it? Party time. A class in each school. For example, the high schools would be the senior class. Most elementary schools would be sixth grade. Rutland Town would be eighth grade. I think, was it Wells or Middletown?
Well,
Wells would be a combined 5-6 simply because of the class size. And we would give it to everyone with the exception of Proctor Elementary, and they already know because we've already encumbered funds for them. $7,500. And Lewis would provide the paperwork to the building administrators. Because it is a federal fund, there are certain restrictions and things like that. And so, for example, within the high school, they could take that money and they could use, let's say, $2,500 for prom or $2,500 for their senior banquet, and then the remaining for their class trip or something like that. That would be up to the building administrator and the class to make that decision. Most of the younger classes in Proctor, 6th grade goes to Boston. 8th grade in Rutland Town goes to DC.
DC and Vermont, it alternates.
Yeah. So every class, all these classes kind of have a steady place where they go, with the exception of the senior class, other than they have a trip, they have a banquet, and it would also be, I guess, in a way, assisting the junior class, because in most high schools, junior classes put on prom, but they're just as lacking in funds as everyone else. And so that would be the recommendation from the executive committee, to give Lewis the authority to contact all of the building administrators and share that information. Concerns, comments, questions?
What's the bill?
So it would be, I don't know.
About 35?
Did you put it in there?
I
Yeah.
don't know. Student
We talked the other day about 7,500 per school times 8, so it's, it was 60,000, I think we looked
Yeah.
at.
And that would come out of the enrichment piece. And so my feeling with that is, these are all enrichment pieces. Going on these trips are monumental. And I can speak as a parent of a senior that graduated last year, and they were not allowed to plan, not allowed to do anything. And then all of a sudden they said, oh, you could go on a senior trip. And the senior trip for graduating seniors, they went to the arcade miniature golf place down on your way to Manchester. So, and it's a lovely place, don't get me wrong.
Still, yeah.
But the 6th grade class went there for their trip also. So, it feels like it's the right thing to do. And seniors take a lot of pride in, presenting what they're going to do, putting this timeline together. We're going to get on the bus at 5 o'clock. We're going to do this. It's all about that kind of last hurrah with the senior class. And when you think about the 6th grade and the 8th grade classes, when these kids start at school, by the time they're 2nd, 3rd, 4th graders, they know in Proctor, when I'm a 6th grader, I'm going to Boston. In Rutland Town, when I'm in 8th grade, we're going to DC. And so it adds back, in my opinion, a piece of normalcy. But I also think there are enrichment pieces.
Oh, definitely.
Sending kids to Washington, D.C., sending kids to Boston. And even if a senior class decides they're going to go camping for 3 days, there are pieces about that are enriching, transferable skills that we like to talk about at these tables that we set around. And so that is our recommendation going forward from the executive committee.
So was it $2,500 per high school or $7,500 per high school?
For high school.
No,
Per
it's
school.
7,500 per school.
So it's
Yeah.
52,500 total
Okay.
for 7 schools.
So you're dividing that X number between whatever,
Say Rutland Town gets 7,500.
that's what I'm trying to
Okay.
figure out.
Yeah.
Yep,
That's
so
all.
we would get 7,500. It would be up to administration
Correct.
To
to
decide-
decide what. I would assume it'll go to the 8th
Correct. But
grade.
in a school like West Rutland, would actually get more than that. because
Yeah,
have-
they get a, yeah.
Right.
So
this-
it's 7,500 per class that fits in this category.
Yeah, either a 6th grade class or an 8th grade class and a graduating senior
So
class.
the total money is roughly?
60,000, because Restaurant has 2 classes. with it.
Yeah,
And if the money doesn't get used, it goes back.
yeah, so if they don't use $7,500, that money leaves, so,
I'll make the motion.
okay.
I'll second it.
All those in favor?
Aye.
Motion passes. Thank you. All right, Louis, you're good to let all the building principals?
Okay, I'll work on that notification.
Thank you very much. That way it'll give them an opportunity to start planning.
I'm waiting for her to at least smile on me. I mean,
What, oh, you have an 8th grade?
Can I at least have a smile? Did I not just help you?
It's been there. You just can't see
I
it.
can't, all I see is this.
Good work on that one.
All right.
We do sometimes come up with good things. We do save you from a lot too, just so you know.
Sometimes we are a clever bunch.
You got it. You got it.
I do want to thank you for that because I know a lot of families are struggling with the cost of the trip and the fact that fundraising doesn't look the same. We're not allowed to do the same things. There's no bake sales, there's no raffle
Right.
baskets. Groups aren't allowed in the school, so it does make it very difficult.
Yeah,
So-
and we're giving it, and maybe come February or March, fundraising can be, and classes can still continue to do, something.
But deposits are due in March, so.
Oh, I know.
So
Yeah.
it's
Yep.
very helpful and appreciated.
Well, I think it's also a positive to have these classes, particularly seniors, or to start thinking about and planning and getting that together, I honestly, as a parent of a senior last year, there were a lot of things they didn't have.
Right.
And when they did have, they came so quick that there was no real planning. And there's a lot of, there's a lot of grumping, but there's a lot of joy in the planning also. And so,
You figure their graduations were really,
yeah.
8th grade never went anywhere, ours last year.
Yeah, it was
Just,
tough.
it's tough,
So,
and it's part of COVID, it's part of the depression, the things that
Right.
hold you down. I think it's gonna help the
but it
kids
gives them that
tremendously.
light, I think,
Yep.
at the end, that we do see things are changing and at least allows them to plan, so. If they have extra money, they can always take a board member on one of these.
There you
trips.
go.
There's a plug.
Yeah,
Policy coming up.
you saw who it
I
came from.
wouldn't have fun if I went. I would be miserable
You'd
the
be
entire time.
supervising,
Yes.
observing.
Okay.
Comparing to 13 seniors.
Anything else on the budget that we could discuss here?
I can't think of anything we talked
Okay.
about.
So, any old business? New business? The only new business I had, and I would like, with the hope that we can adopt the budget this evening, not have a December meeting. That's
Yes.
something we have done, so.
Well, you might want to explain to them also on how stressed everybody is with all these meetings, and we're
Yeah,
trying to
we-
come up with a time for negotiations, and
Yeah, and we're entering both sets of negotiations, so it's.
we
For
just
some
don't have any
people,
days.
Yeah. So if there's no, as long as we come out and adopt the budget this evening, there's no pressing for the December meeting, unless, Eric, you want to come?
I'm fine without a December meeting.
Okay.
How about you? You want to, I mean, if you're lonely, you can come in and sit.
I'll be here December 22nd regardless.
At 6 o'clock at night?
No, well,
Okay.
depends on the day, I don't know. So
Okay.
hopefully not.
All right, so hopefully on the premise that we're going to adopt the budget later this evening, we will be canceling the December 22nd meeting.
We can make that motion later, right?
Right.
Okay.
Policy, so we have policies before you for first reading. B4, board commitment to non-discrimination. C2, public participation at board meetings. F11, limited English proficiency students. Those are all first read policies. The second group are second read, so a motion will be in order for those. Second read, A1, the role of policy. A2, policy dissemination, administration, and review. B3, board member conflict of interest. C1, board meeting agenda preparation and distribution. C4, board superintendent relationship. F13, harassment, hazing, and bullying. And prevention of sexual harassment as prohibited by Title IX. And I'm not sure what the number is for that one.
I didn't see any problem with them, with the second reads.
All right, so a motion would be in order to approve the second reads.
I'll move to adopt the second reads as presented.
Okay?
I'll second it. Oh, sorry, Mike.
All those in favor?
Aye.
Any opposed? Motion passes. All right, we do have need for executive session to discuss personnel related to the budget. You do have a link, a second link for executive session, just.
Don't have it, Kirsten?
I do not have it, just because I probably didn't get it. I'm not a regular attendee here, so if somebody
Oh.
can shoot that,
Oh,
that'd be great.
oh, that's right,
Thanks.
because it probably would have gone to Seth. Yeah, so
During the
we'll,
break, I'll send it to you.
yeah, we'll send it to you. We're gonna need, can we be back here at 8 o'clock? We're gonna need to allow PEG TV to clean up. So if you all wanna come
time it
back
is.
in the second, in the executive session link, that would be great. And for the public, we will come back to this link before our, in order to adjourn, and if there are any action.
Who else do we need to invite in? Do we need Louis, Greg?
We'll need Louis, I think we need to have discussion and then we'll bring Greg in so we can text Greg to come back. Do they have the link? I mean, I'm sure Louis does,
Do we
but.
need Christine now?
Christine? No, I think we already took
No,
her.
we're all set with Christine, yep.
Yeah. All right, so we're gonna, it's 7:47, we're gonna take a break and let PEG TV clean up, and at 8 o'clock, we'll come back.
Thank you.
Thank you.